sorry, Jenny, not sorry.
Right. Well, good morning, everyone. Thank you for joining us, and it's really a great pleasure to be here today. I want to extend my sincere thanks to Shelley and all of her colleagues. The team at Walmart here today has given us a very, very warm welcome. Walmart has played an important role in supporting Ontario's response to COVID-19, whether it's helping to get vaccines into arms or providing essential goods and services. We are truly grateful for their dedication and hard work. With key public health and healthcare indicators continuing to show signs of improvement, last week Ontario began to cautiously and gradually ease public health measures. Hospitalizations due to COVID-19 continue to decline, and we are currently tracking towards the best case projections thanks to the sacrifices of Ontarians and unwavering efforts of our healthcare workers. We understand the impact Directive 2 has had on Ontarians in need of care, which is why we intend to lift Directive 2 in the coming days and begin a gradual and cautious resumption of surgeries and procedures. The Ministry of Health and Ontario Health are finalizing the details on a phased approach to resuming this care for patients across the province. As we continue to gradually ease public health measures, I'm very pleased to announce that starting today, Ontario is expanding access to free rapid testing kits to everyday Ontarians. 5.5 million rapid tests will be made available each week at over 2,300 pharmacy and grocery stores across the province, as well as through community partners in vulnerable communities. In total, the province is making 44 million rapid tests available to the general public at no cost to them over 8 weeks to ensure Ontarians have tests available when they need them. These tests will provide another layer of protection, support the province's efforts to cautiously and gradually ease public health measures, and offer people an additional tool that they can use to confidently do the things they love, like visiting family or dining out at their favorite local restaurant. Participating retailers will decide how to distribute tests to best serve their communities, including through appointment bookings, at checkout, or through online orders. I encourage everyone to visit ontario.ca/rapid test for more details on how you can access tests at a location near you. In addition, we are working with lead agencies through our high priorities community strategy to ensure vulnerable communities disproportionately impacted by COVID-19 have easy and convenient access to rapid tests. Lead agencies will work with their local partners, such as community centers, community health centers, places of worship, and food banks to bring rapid tests directly to Ontarians. Expanding public access to free at-home rapid tests is in addition to the millions of rapid tests deployed each week to support priority settings, including hospitals, long-term care homes, schools, and other places of congregate living. We continue to procure additional tests where possible, with a total of 157 million tests procured directly by the province to date. And we continue to work closely with our federal partners to ensure we have the supply we need now and, of course, in the coming months. While rapid antigen testing will add another layer of protection against COVID-19, it's important to remember that vaccines remain the very best defense. If you still need your first, second, or booster shot, it's not too late. There are many appointments still available. Please get vaccinated as soon as you can. So thank you very much for today. I would like to now hand it over to Shelley Karoff, Walmart's Senior Vice President of Health and Wellness and Pharmacy, to say a few words. Thank you.
Thank you, Minister Elliott, and everyone here today. So welcome to Walmart. We're so grateful to have you here today. And first, we'd like to thank you for your leadership, for everything that you're doing to push Ontario forward during this pandemic. And if you think about it, at the beginning of the pandemic, our goal at Walmart was to serve as many customers as possible. Whether that was providing an essential service at the beginning of the pandemic, or if it was based on our pharmacists who have been working around the clock to vaccinate as many Ontarians as possible. Our commitment to our customers' health and wellness has never been stronger. And we have a thriving health and wellness business where we offer a wide range of health products and services. In fact, every single one of our Walmart stores in Ontario has a pharmacy that is fully staffed with healthcare professionals, and they are ready to serve. And if I may, I'd like to call out a special thank you to our healthcare teams at Walmart. We have vaccinated over 800,000 Canadians alone, and we are so proud of that. And in this store alone, they have vaccinated over 3,000 people. And these are the families in our communities that we serve, where every vaccine makes a difference. And we are so proud of how our teams have showed up to serve their communities during such a challenging time. It's actually really remarkable. Which brings us to where we are today, in the second phase of the pandemic, and we are really thrilled to step up and be part of providing easier access to the rapid tests. Like many other retailers, we're looking forward to partnering with the provincial government to get more tests into more hands. And we will be doing that through our online pickup service, where customers will be able to place orders, and with that order, they'll be able to pick up a rapid test while supplies last. So in closing, we're eager to get this program off the ground, and on behalf of Walmart, we'd like to say thank you for joining us. And I will now pass it back to the Minister.
We'll now go to the floor for questions. Just a reminder, it's one question, one follow-up, and then we will go to the phone lines following.
Hi, my name is Stephanie. I'm with CTV Kitchener. My question for you is, now that case counts are coming down, will the general population be able to access PCR COVID tests?
Well, the PCR COVID tests are currently being used in very vulnerable locations like long-term care homes, hospitals, some retirement homes, homes of congregate living, and so on. As we receive more tests, we may re-examine that, but we believe that these rapid tests are going to be very helpful to the general public, as well as to many businesses that need to have people tested before they come into work.
Right. Now, will these rapid tests, now that they're being deployed, is this a sign that Ontario is looking to ease restrictions, similar to what's being done in Quebec, Alberta, and Saskatchewan?
Well, we have said from the beginning that we want to ease restrictions as soon as it's safe to do so, but we're doing it in a very cautious and prudent way. And we are seeing the case counts come down in the hospitals, thank goodness, I think, for all of us. It's 2,059 people in hospital today, whereas last week it was over 2,900. So we are trending in the right direction. We, of course, are working to ensure that this trend continues, but we want to remove the restrictions as soon as we can, based on the recommendations of the Chief Medical Officer of Health and the scientists that understand these trends very well.
Thank you.
Good morning,
Jamie.
Deputy Premier. Good morning. We're seeing demonstrations at the border crossings. How concerned are you about these demonstrations, and how will your government predict it, or how has your government reacted to the border crossing shutting down the supply line?
Well, we are concerned about the demonstrations, of course. We really recommend that everyone get a vaccination. That's our best way out of this pandemic, to move into an endemic. We're not there yet, but we want everyone who can to receive the vaccination. We understand people have a right to protest, but as long as it's not breaking any laws or causing damage, it's not spreading language that's not appropriate. So we are watching very carefully. We've seen what's happened in Ottawa. We witnessed what was happening in Toronto last weekend. And again, as long as it's peaceful protest, that's fine, but it can't be destructive. And it also can't block hospitals, either for healthcare staff to access hospitals or for people to receive treatment.
Thank you, Deputy Premier. The next one's to the Senior Vice President of Walmart. If I can ask her a question, if that's possible.
Certainly.
How concerned is Walmart over the border closures and the demonstrations? How long will it take before it affects what's on the shelves?
I think in terms of the border closures, I think, like myself, we watch it every night, and it's certainly a concern for all Canadians. And we'll leave it to the federal government to address and see if we can move things forward. I think what I would say on behalf of Walmart, we're happy to be here today to support the minister and support the province around moving the province forward in this pandemic.
We'll now go to the phone lines for questions. Over to the first question, please.
Your first question comes from Holly Mackenzie-Suter with the Canadian Press. Please go ahead.
Hi, Holly.
Hi, Minister. I wanted to follow up about the question about other provinces dropping restrictions, like Alberta and Saskatchewan specifically are looking to drop vaccine passports and masks pretty quickly. So I'm just wondering if Ontario is looking to do the same, like planning to adjust its plans at all based on changing indicators, or if you just have any more information about how the reopening timeline might change, specifically around those vaccination and mask measures.
Well, we've already set out our opening timelines. We started on January 31st. The next phase is as of February 21st and then March 14th. We have no plans currently to drop the passport vaccination situation or masking. We believe that masking is going to be important for some time to come. And of course, we take our advice from Dr. Moore, the Chief Medical Officer of Health, and the people at the Science Advisory Table and other medical experts. And so we always said that we were going to take a very cautious, phased, prudent approach to opening up, and that's the path that we're going to follow.
Follow up.
Hi, yeah, I'm wondering as well about the rapid test results, because we know Quebec is trying to track those in a centralized way. And I'm wondering if Ontario is going to try and do a similar thing now that you're making the tests more available to the public. And if you're not planning to try and track the results, can you explain why?
Well, they're not going to be entered into the COVAX system, but what we're taking a look at is more of the extent of COVID circulating in the community, and that comes to us from a variety of ways. One is the number of people who are hospitalized. That doesn't tell the entire picture, of course, because we don't have all of the results of the rapid test, but it is quite a good indicator of what's happening in the community. We also have wastewater surveillance that gives us some indication of what's happening, and the number of people in ICUs. There's a number of different other indicators that we're looking at that tells us when it's safe for us to ease further public health restrictions.
Next question.
Your next question comes from Brian Lilly with the Toronto Sun. Please go ahead.
Hi, Brian.
Good morning, Minister. I know that you said you laid out your plan, but your plan going up to March 14th makes no mention of when we might see removal of vaccine passports or masks being required. So you have looked at the information, you're briefed daily. While Dr. Moore and others advise the government, it is you and the other members of cabinet that make the decision. Given the information that you've seen, do you believe Ontario will be moving forward prior to March 14th on reducing the need or eliminating the need for vaccine passports or mask mandates?
That is something that we continue to monitor on a daily basis. taking a look at what's happening in the community as we know it, looking at the statistics on the number of people who are hospitalized, what the wastewater surveillance information is telling us. And so we are willing to change if necessary based on the evidence and based on what we see and the recommendations that we see and hear from Dr. Moore and his colleagues. So it's a combination of many factors that we as a government take into consideration in making any changes to the plan that we've already set out.
Follow up.
That was a nice dodge, Minister, but I'll come back to it. You see the information every day. You see more information than you release to the public. The hospitalizations are trending down and have been for weeks. The test positivity is on a downward trend. The wastewater is on a downward trend. Are you telling the people of Ontario that you have no idea of whether you plan on ever lifting vaccine passports and mask mandates? Are we just going to live with these forever? Or until you feel you have sufficient cover from doctors? Because you're the one that makes the decision. You're the one that makes the recommendation to Cabinet as the Health Minister. So where do you stand on that?
Well, you're right. We are the ones that make the decisions, and we are looking at the evidence on a daily basis as well. The trends are going in a good direction now, but we can't sit back on our laurels and assume that's going to always continue. Omicron is highly transmissible. We have the variant, the BA2, in some parts of Ontario as well. While it doesn't appear as if it's going to be a more dangerous variant than Omicron, it certainly appears to be more transmissible. So we still need to be very careful. We are not telling the people of Ontario that this is going to remain in place forever. No, but we're not in the clear just yet. And so we need to continue to protect Ontarians, protect each other with the passports and with the masks at this point.
Next question.
Your next question comes from Lorenda Redikoff with CBC. Please go ahead.
Hi, Lorenda.
Hi there, Minister. With these multiple protests in different parts of the province, including now at a major border crossing, we're not hearing from the Premier. Where is he, and why isn't he speaking about this?
The Premier is working round the clock to work on helping to open up our economy, to make sure that people get their vaccinations. He is working hard with us day to day, and I know that this is a matter of concern to him, but we also need to work with the federal government too when we're border crossings, and so we ask the federal government to assist with this as well.
Follow up.
On the rapid tests, the last time that these were made available, we saw huge lineups, and then in some cases, we saw people selling them later on the black market. What are you doing to ensure that that doesn't happen this time?
Well, first of all, we know that the organizations, the pharmacies and the stores that are offering the rapid tests, some of them have their own systems for ordering. Some people have to order online and then pick up in store. So that will give them the opportunity to make sure that they don't have too many people coming in too often to receive the tests. But we also know that we're in a much different situation this time than last time because of the quantities of the tests that we're receiving. Last time it was a total of 2 million tests and that were taken from the shelves very, very quickly. Now we have 5.5 million tests per week that are available to people. And we know that most Ontarians want to have the test. There's 5 tests in each box. They know that they want to protect their family and need them for specific purposes, and that they will do the right thing. But we also have the ability to find people that are obtaining tests that they don't need for their own purposes and trying to sell them online. But with the vast quantities available now, it wouldn't appear that there's going to be much of a secondary market because people can obtain them quite readily.
Last question.
Your final question comes from Jeff Gray with the Globe and Mail. Please go ahead.
Oh, hi, thanks. Minister, I wanted to ask about Directive 2. These graphs from the science table yesterday that looked at the sort of sustained impact of Omicron on the hospitals, even with a more optimistic level of vaccination still show, 2,000 to 4,000 patients well through March and several hundred in the ICU. Are you confident the hospitals can reasonably get back to business as normal, even given the fact that they also will have this backlog they'll be trying to fill?
Yes, we know, first of all, that many people have had surgeries and procedures postponed, some for very long periods of time. And we want to be able to get back to be able to perform their surgeries for them. I know this is very concerning to many people, especially if they're waiting for cancer or cardiac surgery, but many other people are waiting for orthopedic surgeries and other surgeries as well. So this is something we want to get back to as quickly as possible. One thing that I would note is that our government has brought in 3,100 extra beds at a cost of over $5 billion since the beginning of the pandemic. Those beds are going to stay because we need to help people that have been waiting for these procedures. And yes, I do feel confident that we will have the capacity in our hospitals to help them as soon as possible. We are looking at lifting Directive 2 very soon, and I know that Ontario Health and others are working at lifting this. Chief Medical Officer of Health are looking at lifting this as soon as possible so we can get back to all of those surgeries that many Ontarians have been waiting long periods of time for.
Follow up, and this is the last question.
Thanks, Minister. I just wanted to ask a sort of a clarification about your remarks off the top. You mentioned about the rapid test that you said something to the effect of this kind of thing. But in the technical briefing, it seems the official guidance from the ministry is to not use the rapid tests on asymptomatic people before a social gathering. Could you maybe clarify your remarks on what you meant by being able to go out to dinner and so on?
Sure. Well, there may be situations where people want to see a senior family member who may be very vulnerable, may be immunocompromised, may have other concerns. And so it would be safe for the family to be tested in those situations, but not just to go out and get a test because you want to go to a party. That's not what this is intended for. This is intended to be used to protect vulnerable people in our community.
Thanks, everyone.
Thank you.